have a
probably this side.
That side tighter? Okay. So let's start with the good side. And what we want to do is to just keep the leg nice and straight. Now we don't want to force the knee into straightness. We just want to assess how the hamstrings respond when you go into a straight leg hip flexion. So just take the leg, oh no, we're doing this active, we're not in level 4 yet. So just lift the leg up towards the ceiling, and you have got just below optimal range of movement in your hamstring. You're aiming for 90 degrees, which would be roughly around about here, to where your trochanter meets your hip. So 90 degrees, you are say 75 degrees. So a little bit tight on this side. Cover that side up. And then we'll see, and then lift this leg up towards the ceiling, keep the knee nice and straight. And I would say yes, that this one is slightly tighter than the other side. If you were to bend the knee, you can go a lot further. The hamstring is now released because it attaches to the lower leg. And so you need to make sure you've got a straight leg when assessing the hamstrings rather than a bent leg. Okay, good. And then if we go face down. So now the tight hamstring is the one closest to me. So I said when we were doing our palpation and drawing our muscles on, I'm just going to tuck in through here and lift it up a little bit more.
Yes, ma'am.
When we were drawing the muscles on, I asked the guys to just push the heel up into the hand, and then you'll see, and you'll be able to feel the two tendons for the hamstring. So on the outside, you've got you've got the bicep femoris, and that comes all the way around and covers the bulk of the hamstring. And then if you were to feel behind the knee through here, you can feel the membranosus and tendinosus tendon as well. And that one tends to stay to the inside of the leg. Okay, so you've got bicep femoris, membranosus and tendinosus. And when we do our massage, we're looking to cover all of those muscles. If you lift both ankles up for me, and then back down again. Perfect. With the towel, I've tucked right in to the short line, and I've lifted right up so that we can get to the origins right up in the top of the hips there. Okay. As our focus is the hamstrings, we don't have to flush out the calves every time. We can now go into the hamstrings. Going off. If you're doing flat hand and you're just putting the oils on and it's quite superficial, I tend to turn my top hand sideways and just cover my fingernails so that you don't catch skin as you move up into the glutes like that. You just smooth the way through, and then as you get to the top, sweep out around the trochanter, light pressure on the way back, and you just transition your weight from back leg to front leg, working your way up bicep femoris, and then make sure that you cover and add oils to the medial knee so that you can get into the membranosus and tendinosus. Hamstrings generally can take a little bit of pressure, and you'll want to put a bit of pressure on so that you can feel where those tender spots are. So I can feel a nice tender spot right in the center of your bicep femoris. So we'll just make sure that we warm up well. Keep adding oils when needed. You've got that soaring action of just starting by the wrist and working your way along to the elbow, going all the way up through to the tendon at the top of the hips, and then just sweeping out, light pressure on the way back. Applying your pressure just as you move past the knee joint. And working my way through. Petrissage. Turn to a side-on stance. And then make sure you keep your thumbs in and you use your body to generate your pressures all the way through. The bicep, the semimembranosus and tendinosus is quite far around, so you want to make sure you've got good coverage. And if we're going in to treat those two hamstring muscles and we're going in to treat like a medial knee pain, you want to make sure that you gather up the sartorius, which is quite far around the front, and the adductors and the gracilis. And so you want to make sure you've got good coverage the whole way round the back of the leg. And that will feel quite nice, and that's starting to mobilize and to stretch those muscles. So, make sure you can see this one now. So, if we're going to go into the semimembranosus and tendinosus, the tendon inserts into the tibial shaft, just on the medial side there. So with your massage, position yourself so that your hips are level with your client's hips, and then just start to lightly lift the soft tissue in and around the inside of the knee. And then as you come past the knee, go into a nice deep lunge, and then just pick up the semimembranosus and tendinosus and pull it towards you. Now we're getting a reaction like straight away with that quite light pressure on there. Just gathering the soft tissue past the knee. You have to come quite low, otherwise if you're quite high up, you'll just pull the leg off the couch. And you want to make sure the palms of your hands are on your client to keep them fairly steady. Sink back, imagine you're water skiing off those two little muscles. Lean back, and then all of the pressure will come through your weight transference rather than using your grip. Also make sure that you support your fingers, one hand on top of the other, and then pull in that way. So you're moving in a diagonal. So this is going to really stretch and mobilize and reduce any tension on the inside of the knee. And you can feel that's quite intense. You don't really need to do much more than that for you. And it might just be that we spend 5-10 minutes working through the semimembranosus and tendinosus, just working up the back of the leg. And you can see, even with quite light pressure, you are finding that therapeutic.
Yeah, that's the word.
Okay, you can progress that. So if you were going into the medial side and you wanted to progress that on, if you lift the back of the lower leg, cup the knee, take the leg up off the couch, move into abduction, and then let the leg drop down towards the couch. Now you are in full extension, and you've taken the insertion further away from the origin. So the muscle now is on a little bit more stretch. I'll be very, very considerate to the fact that it hurts already. Then I'm just going to go into that medial side, and that increases the tension and the stress on that muscle, so you can get a little bit more stretch and a little bit more relief for that medial knee pain. In this position, you can get your client, as we move into level 4, to do loads of movements to increase that stress further and get greater release on there. There's a real tight spot just there on your hamstring. Okay? You've always got to make sure that you are adding in some niceness once you've done some painful stuff. So back to your petrissage, and then when you've finished, bring the leg back up. Now for the purpose of the video, I'm being quite quick. So you'll do a little bit more petrissage, and then we'll get into a little bit more effleurage, flush all those metabolites away that we've just released, and then we'll move on to the next thing. Bicep femoris. There is often tender spots. There was a little tight spot that I found just in the center of your bicep femoris, roughly around about here. Do you feel anything coming on?
It's not as bad as my knee.
Not as bad as your knee? It's fine. But the bicep femoris tends to respond quite well to some compression work. Your effleurage, petrissage, your compression, and your simple kneading frictions. So with your compressions, we're looking for that little tender spot. Now it's a little bit of thickening and a tightness just there. So here we'll just do hold for a few seconds, check the pressure's okay, 7 out of 10 max.
Yeah, fine.
Happy. And then release, and then just do 2 or 3 compressions, and release, compress, and then flush it through. Flush those metabolites through. I might come back in, a little bit more effleurage needed, but we're just going a little bit quicker for the video. Back into that spot. Store. A simple reading friction would be to go with the line of the muscle, so going from proximal or distal to proximal, just frictioning, using my elbow to move up and down through the muscle, just a few seconds because it's quite painful, and then back into a flush. And you could do that maybe 2 or 3 times. So you've got like 2 minutes worth of treatment time, and then it'll just get inflamed and feel sore, and you won't get any more benefit from it. And so then you can move on. Tendon. It's a good idea. I usually get quite good response and release if we take the massage all the way up to the tendon, and you can feel a line of tension there. And I'm just going up the bicep femoris to the muscular tendinous junction just there. And I'm just doing some compression work and some frictions at that top level. You okay? Send her again there.
I'm good.
But you have to be really careful, so you have to take your pressure off and then just move across the tendon when you've finished, always sweeping to the outside. We'll come in a little bit and just see what's going on the semi-membranosus and tendinosus, which was tight, and I think that's a tighter tendon in there. You okay? A few little compressions and frictions. And then effleurage, flush your way through. So that covers all of your techniques. Once you've done about 10 to 15 minutes worth of massage on the hamstring, you should marry that up with doing the other side as well, and you've got quadriceps to do. So you've got a good 45 minutes worth of massage to do, and that demonstration was probably about 10 minutes, I think, roughly. So you've got like quite a lot of content. Once you've done both hamstrings, come to face up for me. Move that bolster out of the way. Go back round. The hamstring is now further away. And if you just lift the leg up towards the ceiling, so we were on about 75. I think we're a bit better. I think a bit better. So we need more time on it, but I think we've improved it already, which is good. But you should always finish with a passive stretch on there. So when you do your passive stretch, use your shoulder to support, and just support the knee. We're not looking to straighten and put pressure on that knee. Just keep it in that position, and then we're going to apply a little bit of pressure down through the toes, and that will stretch your hamstrings. You feel that nice stretch?
Feeling my calf.
Feeling your calf. So we could ease off and then just come up into the hamstring a little bit more. Hold there for 12 seconds. Passive stretching is 12 seconds. Nice deep breath. It shouldn't be really, really painful. Be a nice way to soothe, ease. And when you've done your passive stretching, support the joints, move the limb back down, and then you're ready to start the quadriceps. Okay? Awesome. Brilliant.
Thank you.
You're welcome. Thank you. Thank you.